So, essentially, here, if you look at your MRI report, you have two levels of some bulging, and then the facet arthropathy is that arthritis that I'm talking about. And that's L2-3 and L3-4, so that's up a little bit higher here.
Okay.
Your pain is a little bit lower.
Yes.
So at L4-5, you have a little bit of listhesis, which just means that the spine's not as aligned properly. And there again, you have some bulging of the disc. So think of a jelly donut. The jelly's not out; it's just pushing out. And that, as we get older, like almost like a flat tire, some of the air comes out.
Okay.
So that's normal. It's not a disc injury, in my opinion. And you have some arthritis, and then they speak about ligamentum flavum hypertrophy, which is causing moderate canal stenosis. And I think that's the problem. L4-5 is where your pain is. So what's happening is this is the ligament, and it's causing that area to be tightened.
Okay.
And this is a normal spine, so I'm saying the fluid is not flowing. So what's like the symptoms? So pain in the buttocks, legs, and it's limits the amount of time that people can stand or walk. And I think this is kind of what's going on with you. So those people tend to bend forward. They sit a lot. When they're standing or walking, right when they stop walking is when their pain gets better.
And the arthritis you said too?
There's arthritis as well in your back. But I think this is what's causing the most severe of your symptoms, because the leg pain is what's limiting you the most, it sounds like.
Well, yeah, because I get that really big jolt, and like I said,
Yeah. So, this
was
essentially,
full.
you have some thickening of that ligament, so the spinal cord area is not free. So, essentially, what you can do is an epidural. I agree, epidural can help with that.
Okay, that's
But the
fine.
fluid's not going to flow there. So, we do something called mild, where we go in, similar to like an injection. We make a small incision about this big. There's no stitches or anything. We clean out that overgrown ligament, and then we inject the medicine.
Okay.
So
Anesthesia, right?
yeah,
It's not considered surgical though.
it's
right?
not considered an open surgical procedure.
Okay.
You can have this.
Okay. Thank you.
So I think that's what's going on with you.
Okay. And the other doctor also gave me a round of steroids pills, which helped, but there were so many side effects they drove me
Exactly.
crazy.
That's the problem with oral steroids. You take a large dose of it, whereas with an epidural steroid injection or targeted injection, you use a fraction of the dose and you place it where it needs to be. So it
Okay.
doesn't need to be systemically absorbed. So
Okay. So, and then if that doesn't help, then what?
that's gonna help. But if
Okay.
it doesn't help, then I would look more into the hip, an MRI of the hip. But
Okay. So the hip you think is part of it too.
I think there might be a component to the hip as well.
Okay.
And sometimes, the X-ray doesn't show, but where you're pointing, that's people who point here. That can be labrum. So there's other parts of the hip. The X-ray only shows the bony abnormalities. It doesn't show the soft tissues
Okay.
and the ligaments and the
Okay.
labrum.
And all this never heals, right?
The stenosis we're gonna improve, and the arthritis is not gonna heal.
Okay, so the stenosis is my pain. That's
I
real.
think your pain is coming from the stenosis, from what
Okay.
you've described in your MRI.
Okay.
Yeah.
Sounds good.
That's what I would do.
So you use a surgery center?
Yeah, so we're based out in Clifton.
Clifton, okay.
Yeah, so I personally do the procedures on Tuesday. I can do it if you want this Tuesday. And I'll go from there.
Next Tuesday?
This coming Tuesday. Otherwise,
Okay.
after that, I'm gone for 2 weeks.
Oh, okay.
Yeah.
Well, let me do it then for Tuesday, Clifton. I'll have to get a ride there. Okay.
Yeah, we provide transportation also.
Oh, you do?
Yeah.
Okay. Is it expensive?
No, it's included. They
okay.
provide transportation for all
Oh,
patients.
that's great,
Yeah.
doctor.
Yeah.
Okay, I have high hopes.
Yeah, I think you'll do well. I would aim for 50 to 75% reduction of your pain.
Thank you so much. Okay.
Okay.
I'll